COVID-19 testing. Getting tested for the virus that causes COVID-19 can help you determine if you either have a current infection or if you had a past infection. There are currently two different types of tests. A viral test, which determines if you have a current infection, and an antibody test, which may determine if you have had a past infection. You should consider getting a viral test when you have COVID-19 symptoms, you have had close contact with someone who is COVID-19 positive, or you strongly believe may be. You've been asked or referred to get tested by your healthcare provider or health department. After getting tested, you should immediately return home, wear a mask or face covering, maintaining physical distancing if possible, and remain isolated at home away from anyone who is not also isolating, has tested positive, or is showing symptoms of COVID-19. Ignoring these protocols defeats the purpose of testing, as your results are only as accurate as the moment you took the test. If your results are negative and you did not follow these protocols, it is impossible to verify the reliability of your true infection status at the time of receiving those results. If you test positive, you should self-isolate for at least 10 days. Monitor your health closely and check for fever regularly. Rest, hydrate, and eat healthy. Stay in touch with your physician. Seek immediate medical attention if your conditions worsen. If you test positive and live with other people, for everyone's safety, remember to stay in a separate room if possible. Use a separate bathroom if possible. Wear a mask if you are unable to maintain physical distancing of 6 feet. Don't share personal household items like cups, utensils, phones, remote controls, etc. If you do share items, ensure they are thoroughly sanitized with sanitizing wipes or spray. Antibody tests are used to detect past infection with SARS-CoV-2, and the CDC does not recommend antibody testing for diagnosing a current infection. Since it is currently not known whether a positive antibody test indicates immunity against the virus that causes COVID-19, antibody tests should not be used to determine if you are immune to the virus. Reliability of tests can vary by type, so always ask your healthcare provider for details on the types of tests they offer, their accuracy, and results turnaround time. To find a COVID-19 testing location near you, call your local health department or search COVID testing or coronavirus testing using Google or the search engine of your choice.